Is that for government hospitals alone? Or do you also have a system where private hospitals are also monitored?
Oh yes, the Ministry of Health is a department, medical services and training, that registers and monitors private hospitals.
Do they take complaints from people?
Yeah, they do.
Is insurance something you're also looking at long term? Because you mentioned the problem of how, ignorance and the lack of education and the fact that people generally do not. You also mentioned poverty, how people do not put money is a list of their priorities. They are hoping that they'll always be in good health. Is insurance something you're also thinking of long term, so that when people eventually fall ill, in the events that they fall ill, they have a wherewithal, they can actually take care of themselves, and the burden is not heavy also on the state government?
Yes, the problem of health insurance scheme has been very challenging. The people that are dealing with insurance today are mainly companies. For the government at the federal and state level, we've had a lot of challenges in starting the national health insurance scheme. Now, the workers somehow have not been forthcoming in accepting, because in dealing with that insurance, you have to take some money from the workers and put as savings for the day. It's not easy convincing workers. Then secondly, and more importantly, what we call the vulnerable group, who are not workers, who are really maybe the artisans and all that. How do you deal with the insurance of such persons? First, we do not have statistics. We do not have proper records. Of course, you know that our national population, yes, we have figures, but if you meet an artisan today, you don't have any way of getting information of that person. So the first thing for us to be able to move forward in terms of insurance is to have records of even the human beings we have in Nigeria here. Their names, their age, where they come from, all those kind of records. Then we will now know, okay, these are the vulnerable groups that probably the government can take care of, keeping money aside for their health insurance. But I see that as not something that is going to happen very soon. Because I was deeply involved in this national health insurance scheme as Commissioner for Health, and today there's emphasis on it. Tomorrow you don't hear anything, and it's just been very static.
Do you have any problem with quacks in the profession? Hospitals that are not supposed to be hospitals, and cases of people that have actually been sent to the early graves because of some unprofessional conduct?
Oh yes, we have quacks, but like I said, the Ministry of Health does monitoring, and I think last year also they were able to close out about 30 hospitals. Even myself, I remember even right there in Asaba, there was a place I went to, there was a project I went to monitor, and I just saw this maternity, signboard of a maternity, and I was curious. I entered.
You went straight in?
Yes, and lo and behold, they were doing not just maternity. First of all, the woman and the husband, they were not qualified. I think the woman had been a health attendant before, now practicing as a midwife. They are not even just doing delivery. They are taking on any. In fact, the two patients I saw on the bed that I had to refer to some other hospitals, they are medical cases, not even. Of course, that is the husband was there, who is supposed to be the dispensing drugs and all that, and it's not even medically trained, and that was right in the state capital in Asaba.
Now you just talked about the state capital Asaba. What's the state of the central hospital you're putting up there?
No, they've gone far. It's a big hospital. Again, one of our staff players. What I've tried to do is that apart from this hospital, I've tried to build up other hospitals that will come close to this but might not be of this standard. And that is why we rehabilitated Eku Baptist Hospital. We have totally rehabilitated it and totally re-equipped it to international standard. And that's the kind of standard we're also getting in Asaba.
So what can people who are coming to, or who will come to Delsos, what can they look forward to seeing when they come? What can you assure them that they will definitely find?
Oh, of course. First, they will find a very, very friendly environment with very friendly workers, and of course they will also find adequate facilities for their medical issues, especially in our key areas. And I need to emphasize this in our key areas. We are not jack of all trades. We are concentrating on some key areas: orthopedics, renal issues. That's why we did our kidney transplant. Neonatology, that is children that are born from the day of birth to the first 28 days of birth. We're also concentrating on the area of radiological services and of course laboratory services. But it's not, having said that, it's not as if we do not attend to other areas, other cases. We do. We have an intensive care unit that is very well.
But do you have accommodation for those type of people who will be coming from outside the state?
No, apart from the bed, the hospital bed, we do not have accommodation. And this is where others will now benefit from the presence of the hospital. Anybody who is picking up a hotel or a hotel around now, of course that hotel will obviously be full because right now you see relations of patients who are pitching here and there. So the fallout of the presence of this hospital, a lot of businesses are springing up.
All right, thank you for coming on, Dr. Manuel, Governor of Delta State, and we're looking at the health sector in the state. Thank you for coming on this morning.
Thank you very much.
All right, well, that's it today on Sunrise Daily. We thank you all for watching. Well, Sunrise Daily, we'll be back after the break.